Oh, sir, it's not audible, sir.
All, and I'm not sure.
So you're
Push to
audible now, sir.
talk.
I think it got stuck in the
To
middle.
push to talk. And now?
Now it's good, sir.
Is it audible now? Yes, I think now I'm coming on audible. The moment I start
Yes, sir. Yes.
presentation, there is a problem. Okay. Let me share the entire screen. Yes. Hello?
Yes, sir, you're audible now, sir.
Hello?
Yes, sir. We can hear you.
I'm audible now? Is it?
Yes, sir. Yes, sir.
Are
We
you
can hear
hearing
you.
me?
Yes, sir.
It looks like my sound is heard, but then I don't know. Hello? Yeah. I think you are able to hear me, and as well as
Yes, sir, you're very much audible.
thank you. And are you able to see the presentation?
Yes, sir.
And now, I think you are. Am I audible, and are you able to see the presentation now?
Yes,
Yes,
sir,
sir.
yes, sir.
Okay, thank you very much. I'm very extremely sorry for the technical problem. And yes, the topic I chose was approach to back pain and approach to low back pain. Well, why I chose this topic was this is a common problem. 90% of the adults experience back pain at some point of our life, and 7% becomes a chronic pain, and male and female are equally affected. At one point or the other, when we are sitting in our OPD, at least once in a day, we will encounter a patient with back pain, or we'll encounter any other disease for that per se, but the patient might be having an associated low back pain of varying severity. So, what is low back pain? Low back pain that occurs in any area below the boundaries of the lowest rib to the buttocks is low back pain, and above the lowest rib is the upper back pain. Well, what are the causes for low back pain? We have a lot of causes like mechanical degenerative disease, spondylosis, facet joint arthritis, spondylolisthesis, and herniated disc from tumors, osteomyelitis, and even visceral problems like pyelonephritis, abdominal aortic aneurysm, etc. But I have classified this back pain into three: the muscle, tendon, bone, and neural elements. So back pain can be caused because of muscle or with tendons, bone, and neural element. Well, what are the causes of back pain pertaining to the muscles? What are the muscles? The commonest muscle which are holding the spine are the serratus posterior inferior, posterior inferior, rector spinae, the main one, and the rhomboides major. What happens? These muscles, there are a lot of muscles there. These muscles go in for a spasm. When the muscle goes for spasm, we call it somatic dysfunction. So that is usually a myofasciitis, or there is a muscular trigger point. It increases on the palpation of trigger point. This is a very interesting thing, which most of us forget, that the cause for back pain could be muscle. And the person can even present with a pseudo weakness. They can even have lower limb weakness. It can present like sciatica, or even the patient can have one limb partial weakness. And the treatment for that is the trigger point release therapy, usually done by the physiotherapist by stretching the muscles. You can localize the trigger point and give an injection there. This is my one of my favorite injection therapeutic procedures here. So when you palpate the muscle, low back, paraspinal muscles, you will be able to find a nodule or a knot there. That knot, on palpating that knot, the pain will aggravate and the pain will also radiate. So that is the trigger point. You might palpate, localize that knot, and give a medicine through an injection. What medicine we give? Usually we give steroid with local anesthesia drugs. The other is an interesting syndrome called piriformis syndrome. There is a muscle called piriformis, as shown in the picture, and that muscle is just next to the sciatic nerve. When an inflammation or an edema of this piriformis occurs, it causes edema of the sciatic nerve, or it causes inflammation of the sciatic nerve, leading to sciatica. This is not because of a disc prolapse. This is because of piriformis. Why does this piriformis go in for an inflammation? What happens to the piriformis? Very common. We call it wallet neuritis. Any person who is sitting for a long duration, who is traveling in a long duration with a wallet in his back pocket, the wallet will continue to press on his piriformis muscle, and the piriformis can get inflamed, and it can counter-irritate the sciatic nerve, leading to sciatica. The treatment is just remove the wallet from your back pocket and put it in your front pocket. The next are the interesting ones, the bones. Well, first is the weakening of bones. You all know osteoporosis. It is microfracture, and because of osteoporosis, the bone gets weakened, and the weight carrying capacity, the load carrying capacity of the bone comes down, and because of this, there is stress on the facet joint, and because of the stress, the neural elements get inflamed, and there is pain. So the treatment for compression fracture because of osteoporosis or weakened vertebra or vertebroplasty and kyphoplasty. These two are injection techniques. You can take a needle through the fluoroscope or through a serum. You put the needle inside the body, and with the help of a balloon, you dilate and you bring back the vertebral body to the normal anatomical morphology, and then give some cement, bone cement inside that. These two injection procedures for vertebroplasty and kyphoplasty. Of course, apart from these therapeutic procedures, you have to give some medicines to increase your bone density. Osteomyelitis. This is another cause for back pain because of bone. Vertebral osteomyelitis present as a subacute back pain that slowly increases over a week. And the pain is severe, and there is no radicular pain. It is localized pain. And it has to be treated aggressively. Usually it occurs in immunocompromised patients like HIV. It involves the vertebral bodies, and just because it involves the vertebral bodies, it involves the end plates and then the disc spaces. It spares the neural elements. It spares the posterior elements. In vertebral metastasis is almost like the osteomyelitis. Presentation is almost like the osteomyelitis, whereas osteomyelitis can be treated with antibiotics and other things. Metastasis is a bad disease. In metastasis presents with a localized pain. Initially, there is a localized pain. It does not cause any radiculopathy or a radiating pain. Later on, once the metastasis destroys the body, there can be a compression fracture, and which can lead to a neurosurgical emergency. So usually when I see patients with vertebral metastasis, I would suggest them to fix the spine either externally with bed rest or some Taylor's brace, or sometimes in young patients who have got longevity, I would go ahead with spinal instrumentation and fix the spine, because this metastasis can cause pathological fracture and can lead to permanent neurological deficit. Already the patient is a cancer survivor who's on chemotherapy or radiotherapy or whatever. And if you render him with permanent neurological deficit, his life is going to be devastating. So I would be very aggressive in treating vertebral metastasis to prevent permanent neurological deficit like paraplegia. And these are the diagnostic methods to say X-ray is the earliest sign to erosion of the pedicle. You will be able to identify the vertebral body begins to lose its height. And in MRI, you'll be able to see the signal intensity changes of the body, and the body will slowly, in a gradual MRI, the body will slowly encroach the spinal canal and cause compression over the neural element. Facet joint pain. There are a lot of things other than disc prolapse. Facet joint pain, like how we get knee joint pain. Any person with an above average weight, body mass index, because of the load of the weight, there is effusion and there is arthritis. Similarly, the vertebral bones have got joints, the facet joints. These facet joints can get inflamed and cause arthritis. And again, this pain is localized initially. But a chronic facet arthritis can lead to a lumbar canal stenosis, which will further lead to neurogenic claudication. These facet joint pains, how do you diagnose them? It is localized pain, and the pain worsens on bending backwards and side movement. It is the arthritis of the spine. So what do we do for facet joint pain? We strengthen the muscles. We give physiotherapy, strengthen the paraspinal muscles. And more than this paraspinal muscles, we strengthen the anterior abdominal wall muscles. And we give some medications like how we give medicines for knee joint pain. But there is no spine replacement surgery like how you do a knee replacement surgery. So you'll have to live with the spine. So take care of the spine, strengthen the muscles so that the bone gets a bit more stronger and arthritis reduces. And in severe cases, you can go ahead with the epidural steroid injection under fluoroscope. And in worst cases, you can even go for a laminectomy. What do? We do a decompressive laminectomy. In worst cases, when the patient goes for a lumbar canal stenosis, we do a decompressive laminectomy and we denervate the facet joint. The nerves are all denervated around the facet joint so that the patient's back pain is reduced. That's how the lumbar laminectomy is done. The other cause is spondylolisthesis. This is a slippage of vertebra on the other. Because of the slippage, there is bony pain, neural pain. The slipped bone edges will press on the cauda equina roots and can cause cauda equina syndrome or neurogenic claudication. This is how the spondylolisthesis looks like in an X-ray or in a CT. And there are 4 grades depending on the percentage of slippage from 25% to 75%. The ideal surgery for listhesis is to bring back the spine to its normal position and fix it with a screw and put a cage. We call it this procedure as posterior lumbar interbody fusion. Sometimes we do a tea leaf transforaminal lumbar interbody fusion. But of late, I have stopped doing this, putting this cage. We just put a pedicle screw and come out, and a lot of studies say that this pedicle screw is sufficient. But whatever, the treatment for listhesis is to put a pedicle screw and fix the spine so that it doesn't move, so that the neural element edema comes down and the patient relieved of his pain. Next cause of back pain is the neural elements. Yes, you'll have disc prolapse. Well, what is disc prolapse? Disc is a disc is a gelatinous substance between the vertebral bones, and they act as a shock absorber. They act as a shock absorber, and they prevent the pressure on the end plates. And when you see the disc has two substances. One, you see the round one is the annulus fibrosus, and the inner round one is the nucleus pulposus. The nucleus pulposus is a soft gelatinous structure that actually is the shock absorber that gets all the stress. But when there is continuous stress on the disc, like when you sit and stand, and when the abdominal muscles are weak, so the weight is not bared by the muscles. It is the whole weight is put on the bones and the joint on the discs. There is a shearing pressure that is exerted on the wall of the annulus fibrosus. When there is a shearing pressure that is exerted on the wall of annulus fibrosus, what happens is the annulus fibrosus tends to bulge out. When that bulge out, you call it disc bulge. When there is a disc bulge, the root that is coming out of the cauda equina is just next to the annulus fibrosus. So when there is a repeated disc bulge, it goes and compresses the root. When there is a central compression, it compresses the cauda equina. When there is a lateral compression, it compresses on the traversing root, and that causes inflammation of the root. And when there is a rupture of the annulus fibrosus, then you call it a disc prolapse. If there is no rupture, then you call it a disc bulge. When there is a disc prolapse, it goes and hits the root, and there is a inflammation of the root. Then you get a radicular pain, which means where the direction in which the root travels down, you develop pain along the root, and there is radiculopathy. That is sciatica-like kind of pain. There are types of disc: central disc, paracentral disc, and far lateral disc. These are have anatomical importance, and then this helps in the approach of surgery. In central disc, there is a different kind of surgery, and there is a prolapse. Lateral disc, there's a different kind of surgery. And based on the varying degree, you have disc bulge, disc prolapse. Disc extrusion is the nucleus pulposus has come out and it has gone down, migrated. And the worst case of disc extrusion is the sequestrated disc. And sometimes you can also have an intradural disc. So, what causes pain? When the nerve is compressed, the nerve should become weak. When the nerve is weak, there should be numbness. There should not be pain. What causes this pain? The factor that causes pain is root inflammation. What is this root inflammation? It is caused by first acute pathology is called chemical radiculopathy. The moment the annulus fibrosus is ruptured out, there are substances inside the disc called chondroitin 6 sulfate, chondroitin 7 sulfate, and tumor necrotizing factors. These chemicals go and touch the root and cause inflammation. So, in a very small disc where there is no gross compression but severe pain, we call it chemical radiculopathy. For chemical